Hi everyone, my name is Natalie Lee. I'm a current P4 pharmacy student at Drake University. Welcome to my topic discussion. We will be discussing Clostridium difficile, also known as C. diff. And just to note that the content of this presentation is based on information as of June 16, 2021 from the listed references at the end of the slideshow, and all views are my own. So some objectives that we will be going over is identifying C. diff, the importance, risk factors, testing methods, treatment, and prevention. So what is C. diff? C. diff is a gram-positive spore-forming anaerobe and is spread by the fecal-oral route, and patient-to-patient spread is an important mode of transmission within a hospital. C. diff is a primary cause of hospital-acquired infectious diarrhea in hospitalization patients and children. So the importance of understanding C. diff is that nosocomial C. diff diarrhea is almost always associated with antimicrobial use. Therefore, unnecessary and inappropriate antibiotic therapy should be avoided. And typical antibiotics such as clindamycin, fluoroquinolones, cephalosporins, penicillins are antibiotics most commonly associated with CDAD, but almost all antibiotics except aminoglycosides have been implicated. So as a student, as we continue to develop our learning, we're going to see many patients on many different antibiotic regimens, and we need to understand the risk of C. diff occurring. So some risk factors that we have is number one for community-acquired C. diff, and also in general is gastric acid suppression. So that's the use of a PPI typically, such as omeprazole, and in hospital-acquired common risk factors are increasing age, severe underlying illnesses, intensive care unit admission, gastric acid suppression, and exposure to antimicrobials. So as we move forward, we just need to make sure we're always taking a look at our patient's medication regimen and seeing if we can discontinue anything that may be a risk factor. So testing, the qualifications for someone to be tested and considered for C. diff testing is greater than 3 diarrheal bowel movements in the 24 hours. Stools must be loose and liquid in order to be tested. If it takes the shape of the container, that's considered liquid. It will not be tested if there is a formed stool, so that test will get canceled. And then considerations for testing as well as if the patient's symptomatic, asymptomatic, for different signs of infection, if they're pregnant, if they had a surgery recently, the number of unformed stools during their hospital stay, if they've had C. diff in the past, or if they even got tested in the last 7 to 10 days. And we do not want to test patients just to show clearance that they don't have it. We only want to test if we suspect C. diff. So as we continue to learn more about the testing for C. diff, C. diff toxin testing of a single unformed stool specimen effectively establishes the diagnosis. So a stool culture is the most sensitive test, but it's not clinically practical due to slow turnaround time. The enzyme immunoassay EIA testing for toxin A and B is rapid, so this toxin A and B is what we're talking about right now. But it's less sensitive, and repeat testing may be necessary if the initial test is negative. And many labs now use newer tests such as the GDH antigen testing, which tests the metabolic enzyme, or we use the PCR, which is the polymerase chain reaction technology. Leukocytosis, hypoalbuminemia, and fecal leukocytes are nonspecific but suggestive of a C. diff infection. So we use these tests in order to determine if the patient is positive for C. diff and if we need to start giving them treatment for it. So the GDH antigen, high sensitivity, low specificity, toxin A and B, test the free toxins, low sensitivity, moderate specificity. The NAAT tests the nucleic acid toxin genes. It's got a high sensitivity, low specificity. PCR tests the presence of toxigenic C. diff, and it has both high sensitivity and specificity. So typically the guidelines say that you'll use the GDH antigen test along with the toxin A and B, and I've seen that at my site so far. And if those contraindicate themselves, we usually run it again, or we'll get a PCR test, and that'll be kind of the final vote if we should begin treatment for a person who may be at risk for C. diff. And we do not want to perform a repeat testing within 7 days during the same episode of diarrhea, and we're not going to test stool from asymptomatic patients except for epidemiological studies. So from a treatment standpoint, we want to discontinue antibiotic therapy if possible. If there's no indication or if their cultures have been coming back negative, then we can discontinue. But if they are positive for C. diff and they are still needing other antibiotics, then we're going to continue that and start either vancomycin, metronidazole, or fidaxomicin. So for some treatment options and the severity definitions, as you can see, non-severe and severe, you're going to give vancomycin 125 4 times a day for 10 days, or fidaxomicin 200 milligrams twice a day for 10 days. And if they have a filament severity, then you're going to give vanco 500 milligrams by mouth or NG tube. And then you can consider any rectal instillation of vancomycin along with or administer metronidazole every 8 hours. So it just depends on your patient and how severe their C. diff is. And this slide shows the recommendations for the treatment of C. diff infections in adult, and this comes directly from the guidelines, so we can find that online. And then preventing and decreasing the spread, so gloves and gowns is a must when any provider or any staff has to go into a room with someone who has C. diff, because it's can be contagious with the spores. Hand washing with soap and water, because that'll actually get the spores off and kill them instead of alcohol-based sanitizer only. Making sure that patient is separate or in their own private room, and having contact precautions for at least 48 hours after their diarrhea has resolved. So, and these are my resources. Thank you for listening, and if you have any questions, feel free to leave a comment.